Welcome everyone, and thank you for joining us for today's OnBoard limited release webinar for the New York Physical Therapy Association. We are excited to provide you with an overview of what OnBoard is and what you can expect in the near future. Before we get started, I would like to introduce the NYPTA Executive Director, Kelly Garso, to share a few words.
Good afternoon, everybody, and thank you so much for attending today. I'd like to thank the Workers' Compensation Board for collaborating with NYPTA to bring this webinar on the board's new OnBoard system to you. I don't want to take up any more of your time, so I will turn it back over to Mike so that we can get started. Thank you again.
Thank you, Kelly. And now to begin with today's agenda, I will turn it over to Pam Barnhart, the board's Communication and Outreach Manager, who also oversees the communication and change management efforts of the OnBoard project.
Thanks, Mike. Welcome, and thank you, everyone, for joining us today, and a special thank you to Kelly for arranging this opportunity for us. This webinar will provide insight on an early component to our business information system, an initiative we're referring to as OnBoard Limited Release. You may have previously heard this referred to as OnBoard 1.0. Before we start with that, we'll go over a brief review of the expanded provider law and what you as a physical therapist need to know to become board authorized to treat injured workers if you're not already. Then we'll step into an OnBoard project overview, including a basic timeline, so you'll understand what's coming and when to expect the full system. We'll detail what OnBoard Limited Release is, why we are doing a limited release, and what processes limited release will change for the physical therapist community. We'll share a sample submission process for completing a prior authorization request, or PAR, in limited release, and provide a sample walkthrough for the new submission process for request for decision on unpaid bills, Form HP1. Next, we'll go over PT-specific FAQs we received about OnBoard Limited Release, and wrap up this session with some helpful resources, leaving plenty of time to answer your questions. So let's go ahead and get started. Before we hop into OnBoard, let's quickly review the expanded provider law, what it means for physical therapists, and how you can apply to become board authorized to treat injured workers if you aren't already. Under the expanded provider law, which went into effect January 1st, 2020, certain types of medical providers can be authorized for certain services. Let's first take a look at what physical therapists can and cannot do in the workers' compensation system once they become board authorized. The table on this slide illustrates what treatment and determinations board-authorized physical therapists can do when treating injured workers. We'll get into the authorization process in just a few slides. While physical therapists have always been able to treat injured workers, those who are employed by a medical practice, as well as those who are self-employed, may now obtain their own authorization. This means that they will be listed under their own name in our Registry of Authorized Providers. And just to note that authorization here is referring to a WCB authorization number and not the ability to authorize a specific treatment. PTs are not able to request authorization for MTG-related treatments. Board-authorized physical therapists are able to treat workers' compensation patients but require prescription or referral from the treating medical provider to do so. They do not have the ability to perform IMEs, or independent medical examinations. So why should a physical therapist apply for authorization to treat injured workers? By becoming board authorized, you can help dramatically improve injured workers' access to health care, and the expanded provider law has already brought thousands of new providers into the New York State workers' compensation system. The board is making it easier than ever to treat injured workers, both as a result of OnBoard and the other system improvements we have put in place. You can learn more about these improvements and initiatives, including virtual hearings, our drug formulary, universal billing via the Form CMS 1500, and enhanced medical fee schedules for board-authorized providers by visiting wcb.ny.gov/betterboard. So how does a provider become board authorized? To apply for authorization, PTs would sign up to use the New York State Workers' Compensation Board Medical Portal and/or log in with the credentials that have been assigned to you. Complete the required training specific to your profession, and complete the new provider authorization request online application. Your authorization runs concurrent with your state license. Whenever you need to renew your state license, you must also renew and update your information on file with the Workers' Compensation Board. For more information on the expanded provider law and how to become board authorized, visit the board's website at wcb.ny.gov and type expanded provider law into the search bar. Now that you're familiar with the authorization process, let's dive into our main intention for today, to fill you in on our latest initiative to make participation in the workers' comp system easier than ever, the redesign of our business information system, OnBoard, with a focus on an early component to the system that we are referring to as OnBoard Limited Release. We have already communicated about OnBoard with a new video, webpage, frequently asked questions, and informational webinars for healthcare providers. So some of you may already be familiar with what OnBoard is. But if you're not, you may be asking yourself, what is OnBoard? OnBoard is the system the Workers' Compensation Board has been developing to modernize workers' compensation system processes in New York State, changing the way stakeholders interact with the board and with each other. Along with our integration partner, CapTech Consulting, OnBoard will replace our current paper-based systems, such as eCase, with a brand new single web-based platform. When fully implemented, OnBoard will improve and expand access to real-time claim data with new electronic self-service features to improve and simplify interacting with the board and virtually eliminate the paper forms currently used. This will improve system responsiveness to stakeholder needs and ultimately lead to providing New York State's injured workers with greater access to benefits and medical care. Since the expanded provider law went into effect on January 1st, 2020, there are significantly more providers able to treat injured workers, resulting in a significant increase in the number of registrations the board will receive. Because of this, the volume of forms received and processed by the board is expected to drastically increase, and OnBoard, our new system, will bring new efficiencies, automation, and paperless transactions necessary to handle this uptick in claims processing needs, ensuring the injured workers of New York State receive the most timely treatment and benefits possible. This multi-year project initially began in the summer of 2019, with the full system being available in mid-2023. But we identified opportunities to implement some early process improvements and functionality sooner in what we are referring to as OnBoard Limited Release, which I'll provide more details on in a few slides. OnBoard Limited Release is scheduled for release during the spring of 2021. In mid-2021, Phase 2 will be available, which includes eClaims EDI 3.1. As I mentioned, the first rollout, called Limited Release, will go into production and be used starting in the spring of 2021. Let's go over why we chose to do a limited release and the reasoning behind our focus on the processes this early release will contain. In order to successfully manage these processes efficiently and successfully, Limited Release focuses on the automation of prior authorization requests, referred to as PARs, and the submissions of HP1, the request for decision on unpaid medical bills. All improvements have been designed to make it easier and more streamlined for providers to participate in the workers' compensation system. OnBoard Limited Release will facilitate electronic communications for the PAR process and all parties involved, and immediately upon rollout will replace the following forms: the attending doctor's request for optional prior approval and carrier's employer's response, Form MG1. And very important note here that with OnBoard Limited Release, the MG1 process will be optional for providers, but will now be mandatory for carriers. The attending doctor's request for approval of variance and carrier's response, Form MG2, and the attending doctor's request for authorization and carrier's response, Form C4-AW. With these processes now going online, you will no longer use paper and you will no longer use faxing. And please note, for physical therapists, the following forms will not be affected: CMS 1500 Post-Narrative Report Form, Form NARR, Occupational Physical Therapist Report, Form OTPT4, and the Online Occupational Physical Therapist Report, Form EOT-PT4. To transition away from paper forms, limited release will move the prior authorization request or PAR process completely online. The only PAR listed on the slide that physical therapists will be submitting is non-MTGs costing more than $1,000, but we wanted you to be aware of all the changes limited release will bring. These PAR process changes include the following. The existing MG1 process will be known as confirmation in the new system, and will be confirmation that the treatment the provider wishes to deliver is consistent with the medical treatment guidelines. MG2 will be known as variance. Special services, which includes the 12 medical treatment guideline or MTG related requests previously done using C4 and greater than 1,000 will be used for non-MTG treatments costing more than $1,000. One of the features of the new system is that you no longer need to know the form you have to fill out for your request. And as you'll see in a few minutes here, the new system will use a TurboTax approach, asking you questions that will lead you down a path to the correct PAR submission type. Another part of OnBoard limited release will be the introduction of a durable medical equipment or DME fee schedule, as certain pieces of DME will require prior authorization. There will also be a PAR for non-MTG treatment costing $1,000 or less, and new medication PARs, as OnBoard limited release will be replacing the current drug formulary prior authorization request process. Similar to the current drug formulary prior authorization process, all completed PAR submissions will be transferred to the eCase folder. And just as a reminder, that physical therapists will only be able to submit non-MTGs over and under $1,000 and HP1s. OnBoard limited release will also digitize and streamline the submission of HP1s, requests for decision on unpaid medical bills. And you will submit Form HP1 solely using the web-based limited release platform. Physical therapists will be able to do this as well. I should note that the rest of the HP1 process will continue using the same procedures as it does today. Only the initial submission will be done using OnBoard limited release. Now let's go over what benefit you as physical therapists can expect when using limited release. You will be able to easily see your submissions and requests on a concise dashboard, giving you 24/7 access to your queue of active submissions and requests to view and take action on. And as mentioned previously, when starting a submission or request, you no longer need to remember a form name or number, or where you get these forms. This will give you a clear path to authorization, ultimately giving injured workers faster access to appropriate treatment. Throughout the process, you also have the ability to receive email and text message status updates on PARs in progress and be able to assign delegates to facilitate the submission of PARs and their status. These delegates will be able to assemble all information needed within the PAR, which will then appear on your dashboard for review and ultimate submission. And a note here, a doctor could delegate a physical therapist that works in their office to create MTG-related parts for them, but the physical therapist would not be able to submit it. Also, the physical therapists themselves could delegate another staff member to create a non-MTG-related PAR that they would have to submit. Others will benefit from limited release as well. Injured workers will receive more timely health care. Insurers, third-party administrators, and medical suppliers will have a simpler system for prior authorization requests. And the board's medical director's office will also be using OnBoard limited release for the reviews that they perform. This process flow that you will follow in OnBoard limited release is very similar to what is now being done for medication prior authorization. It will start by accessing the medical portal. You perform a case search and then answer a series of questions related to the case and what type of care you want to provide. The request will be submitted, and the system provides auto routing and automatic timing associated with the request. The request will automatically navigate the review process within the system. And as previously mentioned, you can assign delegates to perform all of these steps but you must do the actual submission of the request yourself. Now that we've gone over OnBoard and what to expect with limited release, we want to give you an example of the submittal process for what the prior authorization request and HP1 processes will look like in the new system. The screenshots that will be shown during this walkthrough are not final and are subject to change. However, these will give you a sneak peek at how the web-based system will look, how you will navigate it, and the steps you will take to complete a submission. We'll start with the PAR submission process, but please remember these screens that you're about to see are prototypes that currently are still under development. And also know we'll be rolling out a complete training program as we get closer to implementation. OnBoard Limited Release is focused primarily on prior authorization requests. These requests include MG1s, optional prior approvals, optional for the provider but mandatory response from the carrier, MG2s, medical treatment variance requests, C4 auth for non-MTG body parts and special services, DME prior auth for non-fee schedule items as well as certain items that are on the fee schedule, and formulary prior auth for non-formulary medications. With OnBoard Limited Release, prior authorization for medical marijuana will be processed as a medical prior authorization, no longer on an MG2 as it is today. And just reiterating here that physical therapists will only be able to submit non-MTGs over and under $1,000, as well as HP1s. You will begin your PAR request by accessing the medical portal. On this page, there will be a link to the treatment section for a prior authorization request. When entering OnBoard, you'll be presented with your home screen dashboard, which will serve as a starting point for submissions. You will be able to easily view the status of items already submitted, and hyperlinks will take you directly to a specific submission once selected. If someone is a delegate for multiple physical therapists, the status of all physical therapist submissions will appear on their dashboard. To begin the prior authorization request process, you will select Submit an e-form on the top right corner of your dashboard. The next step is to enter requester information, and a few notes on this. As mentioned before, you can have delegates, for example, office staff, that can assemble the PAR on your behalf, but you, as the treating physical therapist, have the responsibility of reviewing and actually submitting the PAR. When you are assembling a PAR yourself, your own information will be defaulted and automatically populated on this initial page. If it's a delegate working with multiple PTs, he or she would need to select which physical therapist the request is being submitted on behalf of, as well as the associated PT license, if there are multiple for that physical therapist. Similar to the current formulary prior authorization system, you begin by completing a claim lookup. This is done by entering either the WCB case number or the carrier case number. Next, you will enter information in two of the following: date of injury, last four Social Security number, date of birth, and/or the patient's last name. You would then select the category of PAR, either drug formulary, DME, other treatment or testing, or non-medical. And just as a reminder, you will only be able to submit PARs for the scope of practice that your authorization allows you to perform. For example, as a PT, you will not be able to submit a medication PAR because it isn't under your scope of practice. After the PAR category is selected, the system will ask a series of data-driven questions, such as CPT code for the requested procedure, code lookup dropdown, either a portion of the code or the name of the procedure, and then select from a list, the MTG site, MTG reference code or description associated with the PAR. Again, this will be a type-down lookup list, the body part associated with the PAR, and if the requested treatment or testing is addressed by and consistent with the MTGs. This completes the process of how an individual PAR is assembled and made ready for submission. Physical therapists will not be able to submit PARs for MTG-related treatment, so be advised that the MTG reference code would not be applicable when you are creating the PAR. You then have the ability to continue to assemble additional PARs on the same patient on the same case. For example, a surgery with subsequent DME and physical therapy, which are all different PAR types, can be assembled and submitted together by the requesting surgeon. This new process makes it virtually transparent to the user that they have submitted different PAR types that use different e-forms and take different pathways. On the left of the request details screen, you're provided an outline view so you know where you are in the process. In this instance, since DME was added, additional details are needed. You will enter these additional details to continue. On this screen, you can see that an additional item has been added to this request. Item number 1 was for an MG1 consistent. Item number 2 is for durable medical equipment. From here, the requesting provider can add additional items or complete the request and finish the prior authorization. Once the PAR is submitted, you will see the status of that PAR in your dashboard. This dashboard is considered the home screen for OnBoard limited release, and from here, you can submit another request or see the status of requests that have already been submitted. The ability to sort and filter is also available, and you can sort by the prior auth ID, the type of PAR, the patient's date of birth, the carrier case number, the WCB case number, last activity, and prior auth status. On the left side, under the column Prior Auth ID, you will see hyperlinks that, when selected, will take you directly to the associated PAR. As I mentioned, you are required to submit the PAR by accessing the e-forms completed by your delegates. This can be done by accessing the Draft e-forms tab from your dashboard. From here, you will see columns for form type, which list the PARs that are ready for review and submission. The hyperlink is used for direct access to review and submission. These can be sorted by WCB case number, whom the PAR is being sent on behalf of, and finally, the status. Ready to submit indicates that the delegate finished completing the PAR, and you just need to review and send. When a PAR gets submitted by a physical therapist, the system will automatically route it to the correct location, removing the need for a fax number. I'd like to walk you through an example of this auto routing and auto escalation by using the formulary review process. PARs will follow these same levels, starting with the prior authorization being initiated with the prescriber here. If the level 1 reviewer at the carrier does not approve the request in full, then it is automatically escalated to the level 2 reviewer within the carrier before it is returned to the requesting provider. If the request is partially granted or denied, the provider does not know that until the level 2 has made their decision and responded. The provider would then have the option of requesting a level 3 review. The only exception is medications which wouldn't apply to physical therapists. Physical therapists can't prescribe or request medication, so they wouldn't be allowed to escalate to level 3 or even request a medication. I'd now like to give you a brief overview for the submissions of HP1's request for decision on unpaid bills in OnBoard limited release. As I mentioned previously, OnBoard limited release will only be used for submitting a request for decision on unpaid medical bills. The remainder of the process will continue using the current state systems and processes. Requests escalated to arbitration or adjudication will continue as needed, using the same processes as today. Similar to PARs, you'll begin by accessing the medical portal. On the medical portal, there will be a link that you will select to submit a disputed medical bill. After accessing the medical portal, you would then perform a case search. and answer a series of questions to begin the submission process. After all questions have been answered, you will submit the e-form to initiate the review process. Again, OnBoard Limited Release will only feature the submission of the request for unpaid medical bills. The next levels will continue with the same process as it has always been done to date, but the new system will provide complete management of submission, review, and processing. We recently held an OnBoard Limited Release webinar series for healthcare providers and would like to walk through some of the PT-related questions that we received. Starting with this one here. Will physical therapists need to submit anything through OnBoard for services to be processed and paid? OnBoard Limited Release will be for requesting authorization and submitting a request for arbitration of unpaid bills only. Can board-authorized physical therapists initiate treatment without a prescription or referral from the treating medical provider? No. Per New York State Workers' Compensation law, an injured worker must be referred to a board-authorized physical therapist for treatment. Board-authorized physical therapists cannot initiate treatment without a prescription or referral from the treating medical provider. Next question here, do physical therapists need to select the treating doctor as provider when submitting a PAR? It depends. If a physical therapist is a delegate of the treating provider and is preparing the PAR on behalf of said physician, the PT would select the name of the physician requesting the PAR prior to beginning the PAR wizard. If the PT is submitting the PAR on their own behalf and is not as a delegate, their information will automatically populate as they will be signed into the portal through their own credentials. Next question, does the treating provider need to do the final submission? Yes, it is always the treating provider's responsibility to submit the PAR, regardless of whether the provider is entering the PAR information themselves or if a delegate is entering the information on behalf of the treating provider. Next question here, will physical therapists be allowed to view the status of an MG2 PAR request submitted by a doctor? In the new system, this PAR will be called MTG variance. The only time a physical therapist can view the status of an MTG variance PAR is if they are a delegate of the doctor. Are physical therapists and their staff able to submit an MTG variance PAR and non-MTG related requests in the new system? Physical therapists cannot submit an MTG variance PAR, but will be able to submit non-MTGs over 1,000 and non-MTGs under 1,000. Only the authorized provider may submit the request, but office staff can create the PAR, which is saved as a draft for the authorized provider to review and submit. Will physical therapists need to submit a PAR for the treatment of body parts that are covered under the medical treatment guidelines? No. Physical therapists cannot submit PARs for MTG-related treatment. They will be able to submit PARs for non-MTG-related treatment that cost over $1,000 and non-MTG-related treatment that costs less than $1,000. Now we'll take a look at the next steps you can take to prepare for OnBoard Limited Release and provide you with some additional resources. First, we once again strongly encourage you to become board authorized. You must be board authorized to treat workers' compensation patients. And to learn more, visit our website and search Become an Authorized Provider. You should also conduct a review of any current systems and procedures to identify potential impacts. After going live with OnBoard Limited Release, the board will no longer be using paper for PARs or HP1 submittals, so please ensure your procedures are in place for day one. We also encourage you to review the OnBoard webpage. The content featured there will provide you with an understanding of the changes associated with OnBoard Limited Release. As we move closer to using Limited Release, the board will be providing plenty of opportunities to receive updates and training. We'll be hosting a monthly webinar series for healthcare providers starting in January, and we urge you to subscribe for OnBoard news. We'll let you know how to do that on the next slide. Just prior to OnBoard Limited Release being available in spring 2021, we'll be providing just-in-time training webinars to provide you with everything you need to know for day one. Fact sheets, training guides, and video tutorials will also be developed, and website content is being continuously refreshed to assist you along the way. You can visit wcb.ny.gov/onboard and select the Get Involved and Stay Informed tab to sign up to receive email notifications to stay informed on resources and to register for upcoming webinar and training opportunities. We'll also be providing you with support channels so you know where to go if assistance is needed. We hope you found this walkthrough helpful and to give you an idea of what to expect with OnBoard Limited Release. For more information, you can go to the OnBoard webpage at wcb.ny.gov/onboard, where you can find an overview and timeline, FAQs, and additional resources. This is also where you can subscribe to receive OnBoard news straight to your inbox for both OnBoard Limited Release and the larger OnBoard project.